Thank you, Anthony, and pleasure to be here with all of you. We're actually partnering with a lot of the organizations around the table, so I might not spend too much time introducing CCAN. So we are a city-focused multi-stakeholder initiatives. We're present in 11 cities across 11 different low and middle-income countries. In Africa, we're present in 3 countries. We're present in Kumasi, Ghana, Nairobi, Kenya, and in Kigali, Rwanda. And we'll be expanding very soon, so keep your ears open. First, I just want to thank the other speakers who did reality checks, I think, which are really important. I want to thank, in particular, the intervention on palliative care, because I think it's way too often that we consider palliative care as a burden and as a non-cost-effective intervention, while it's absolutely the reverse. And we're big believers of this kind of whole system approach at CCAN, and I think that's really interesting, and I would love to collect data actually on that front so that we can also disseminate that data and do more advocacy on this piece. So we are a data-driven organization. The whole point of City Cancer Challenge Foundation is to collect data on the ground to then generate insights, which can then drive the development of projects which are fundable. I personally come from the world of private equity and venture capital. I am not a doctor. I'm not coming from the global health space. And I really know that this space is lacking massive data, like investors, investment managers are looking at cases only if they see that it's worth investing, and they're not going to do any effort to build their own pipeline, like collecting that data. And that's exactly the problem in palliative care right now. It's considered as a non-cost-effective intervention because the data is not shown. So there is no investment case for a palliative care center. I mean, very few investment cases for palliative care centers as a cost-effective intervention to improve cancer care. That's exactly what we're trying to do. So first, get the local stakeholders to collect that data following our process using our platform so that it's structured data, it's usable data. I can't say we're at a point that the depth of our data is matching private equity standards. That would be really idealistic, but that's what we aim at. So I think it's also important to do a bit of a reality check in terms of what everyone is doing around the table and thinking, how do we even build a list of the projects which are being driven in a country? Can you believe that we talk about pilots? There are tons of pilots everywhere in the geographies where we are. When we're in Ghana, who has the list of all the pilots in cancer in the country? No one, not even the Ministry of Health. So whoever we engage with, the governments we engage with, we need to be all encouraging that there is coordination, there is aggregation of effort. The Ministry of Health, it's the realities, especially in Africa, are not putting a massive effort in coordinating the efforts of different development partners. For many reasons, it's absolutely fair, and it requires also investments to do that coordination, but it's worth it. So what we're really trying to do at CCAN is coordinate the effort at a level which is manageable, which is a city. We cannot even try to coordinate that effort at the country level. To start with, it would be impossible. We have so many stakeholders to coordinate, from the private sector, the different level of public administrations, the patient organizations, the other NGOs, international, local, the startups, the innovators, etc. There's one more point on which I'd like probably to rebound, which is the integration of digital interventions into digital health strategies. I think that's something we're battling for. It's also really hard to do and really important. We need data also to build, again, for private equity and venture capital, they look at scale. If you want to scale interventions of digital health interventions, of workforce interventions, you need to think of scale from the beginning. And therefore, you need to build projects which have the long-term perspective of being integrated into the system. And integrating a cancer intervention into a larger health workforce or digitization initiative at the country level is one great platform to create scale. And that's where we all need to kind of put our efforts. And just to close on the financing piece, we always talk about innovative financing. There are a lot of discussions around innovative financing for cancer care. I'm all up for it. But again, there is no innovative financing which can happen without very clear data frameworks, which are first the baseline, and then which can monitor the progress of the interventions. And most countries where we are, do not have that infrastructure in place. So there needs the technical cooperation effort, the technical assistance effort, which need to come ahead of like a blended finance vehicle or at the beginning, needs to be focused on creating that data infrastructure, which can back the creation of sustainable, innovative financing, looking potentially, at outcome-based solutions, all of those things. But right now, we don't have any way to measure outcome in cancer care, literally. Cancer registries are so weak on the continent. So those are just my few thoughts. We are very happy to be part of those conversations. We really want the stakeholders to give the data and to be part of our thinking process. We also have to acknowledge that all of us here have a massive privilege, which is the privilege of having the perspective of many geographies and many actors. When you're in the ground, in the city, you do not have that privilege. You have access to the data, but you cannot generate insights on the data that you are working on. And I think it's very important that we take that data one step higher and we accompany them in the process to think about that data and what they can do with it. And innovative financing is one piece of the puzzle.